Hi everyone, today we will be talking about mindfulness meditation and mantra chanting. And my name is Maria Abid, and my fellow colleagues will be presenting with me as well, Anjali Sandel and Claire Gore.
So, what is mantra chanting? Oxford Dictionary defines mantra chanting as a word or sound that is repeated during a meditative practice. Mantras can include religious or non-religious phrases, and they are used as a tool to avoid distraction and wandering thoughts during a meditative practice. Like most meditative practices, mantra chanting can have a broad range of aims and intentions. Overall, it aims to deepen the meditation practice and encourage focus on the present. Chanting can help the mind focus on speech rather than bodily sensations or mental chatter. Mantras serve as a way to enhance mindfulness and add a new aspect to the practice. Mantra chanting can be used to reduce symptoms of anxiety and depression, along with other mental health disorders.
In this part of the presentation, we'll be talking about the culture and roots of mantra in Buddhism. Mantra chanting is over 5,000 years old. The practice is a core practice in Hinduism and Buddhism. It is believed that through meditation one can achieve mukti and their souls liberated from the cycle of samsara, which is a rebirth. The premise of mantra chanting was found in the ancient Indian and Buddhist scriptures, in which the main chant was or another mantra was used in the process of healing. The sound is the most basic and pure mantra sound that is associated with God or one. Traditional mantra chanting has a rich history and deep-rooted connections to culture and rituals, health and wellness, and religion and spirit. Those three deep-rooted connections represent the mind, body, and spirit that mantra chanting focuses on promoting in health and wellness. The uses of mantra chanting were found in traditional Indian and Chinese medicine. Indian and Buddhist medicine is rooted on a large body of the oldest Hindu literature, which is the Vedic Sanskrit text. In the text there are 4 Vedas: hymns to be recited, texts to be recited, formulas to be sung, and collections of spells, incantations, and charms. The individual verses are called mantras. Rare documents of Vedic physicians indicate that mantra chanting was used during delivery and birth of babies, in rejuvenation cures, in therapy for poisonous stings and bites, and for treating mental disorders that attribute to demonic possessions. Mantra chanting was also used in traditional Chinese medicine by acupuncturists, massage therapists, people who use therapy with dried mugwort, and herbal practitioners. Healing ceremonies use mantra chanting to free the sick from demons, to scare or confuse invading entities in the body, and to improve the effectiveness of healing interventions and medicines. Mantras are cited in contemporary Hindu prayers, religious functions, and special occasions, as well as with Buddhism. In Buddhism, mantra chanting is used to bring the mind greater compassion, better clarity, or deeper understanding. They are used as sophisticated tools that will aid in building a beneficial state of mind. The Sanskrit word mantra is made up of its roots: man meaning mind, with the suffix tra meaning tool. The words and syllables that are in mantra chantings represent different aspects of Buddhist teachings. For example, the syllable symbolizes the body, speech, and mind, which is attained with enlightenment, in which the ordinary body, speech, and mind need to first be purified of their deficiencies. Enlightenment is the state of the Buddha in which one has attained a true stopping, cessation, of emotional obscurations and has cognitive obscurations, realizing in full good qualities to be able to benefit others as much as possible. The Buddhist teachings are found in Buddha mantra, such as the 3 refuges or 5 precepts. When a Buddhist repeats the mantra, then they start to learn them and memorize them in order to teach them to other people in the Buddhist culture. It is a tradition for Buddhists to show devotion to the Buddha by reciting Buddha mantras.
Mantra-based meditation reduces anxiety and stress, including post-traumatic stress, and general psychopathology, as well as causing significant improvements in depression and mental health. General quality of life is also improved by MBM, along with burnout, insomnia, and substance consumption. MBM is associated with reductions in systolic and diastolic blood pressure and is more effective than the usual treatment on reducing trait anxiety and can improve mental health and negative affectivity in non-clinical populations.
Applications of meditative chanting practices in healthcare and rehab settings. Over the past 30 years, mindfulness meditation has gained prominence in medical and behavioral healthcare contexts as a means of stress reduction. So it's primarily been used as a form of stress reduction, but is rapidly expanding towards helping with more conditions, specifically psychological conditions like PTSD, depression, anxiety, and so on. And Buddhist spiritual practices and belief play a critical role in the development of these psychotherapies. Mindful meditative chanting, in particular, has been an approach that has been shown to help many come to terms with past trauma and has been a tool to essentially help people with letting go. Mindfulness has been empirically associated with active coping behavior. It helps regulate their feelings better and face situations directly instead of being avoidant. That is something that's been found by Garland in 2007. And randomized controlled trials have demonstrated that mindful meditative practices increase active cognitive and behavioral coping in cancer patients. That was a study done by Henderson in 2012. One study also found that recurrently depressed patients who had participated in a meditative MBI program felt reduced helplessness and gained a greater sense of control over their emotions and their situation. And recent studies examining MBIs and their effects on the dopamine system suggest that MBIs can essentially de-automatize addictive habit responses. What are some ethical concerns that arise with the increasing popularity of meditative chanting in professional settings? So essentially, there are two main concerns. The first one being concerns about westernization and secularization, and the second being that some practitioners may experience adverse effects by engaging in Buddhist mantra chanting as a practice. And now I would like to specifically draw upon the Buddhist critique of MBIs. And here are some passages I have from two different papers that specifically discuss the Buddhist critique. And the general idea here is that the over-secularization of mindfulness has led to a lot of important critical Buddhist teachings kind of being, in a sense, watered down. And the main issue is that mindfulness is being used more as an approach of symptomatic relief, for instance, in patients with depression or anxiety. So these practices would be catered to them to cure those feelings, but it wouldn't exactly promote the long-term well-being and the path towards awakening, which is the original intention of Buddhist meditation and mindful chanting. The next concern is adverse effects of mantra chanting, and this isn't something that is often talked about. And if you were to look into literature about MBIs, they mostly focus on the benefits rather than adverse effects. But the truth is that some people will experience adverse effects, and this should be addressed. So people who do experience adverse effects, it's mostly increased anxiety, and people who have a history of trauma may get flashbacks and experience emotional discomfort during the meditative practice. And dissociation is another thing that can arise, as well as depersonalization. And lastly, I'd like to draw upon psychosis and the incident of psychosis. So people who are living with schizophrenia and may engage in this exercise may be at risk of psychosis. And this was found in the paper by Dobkin in 2012. So this is the framework that we have suggested to essentially address the issue of secularization. And first and foremost, we believe that teachers shouldn't just have education or be a licensed psychotherapist before they can refer someone to a meditative chanting program. So they should themselves have over 5 years experience with Buddhist practices, and there should be an active line of communication between these teachers and members of the local Buddhist community so that dialogue should be encouraged between the two parties, and that would definitely help with desecularization. In addition, participants should be educated on the sacred value of these practices in Buddhism. For instance, they should know about the Four Noble Truths and the Eightfold Path before they participate in these, and they should understand the meaning of the chants. And finally, measuring the progress of MBI shouldn't be based on symptoms themselves, and there should be more personalized questions involved to assess.
Therapeutic approaches to mental health are not one size fits all. So how can meditative Buddhist mantra chanting be altered to better suit psychological needs of vulnerable patients who struggle with anxiety and dissociation? We have brainstormed how mantra chanting can be changed to accommodate for vulnerable patients. Those who struggle with anxiety or dissociation may experience intense symptoms during meditative practice. When there are changes in perception of the self or of the world, it can induce anxious feelings in many people. A 2017 study by Lindahl et al. Showed that a loss of sense of self during meditative practices was a very common side effect. This loss of sense of self can be anxiety-inducing for many. We suggest that mantra-based meditation can be accompanied by body movement such as yoga or walking in order to limit dissociative feelings and maintain a connection with the body. Yoga specifically has been proven to have beneficial effects on symptoms of anxiety. We suggest that by combining MBM with yoga, people with anxiety may be able to relieve suffering and improve their experience with mindfulness.
The following research definitely backs up some of the suggestions that we had for improving the MBM program. I'd like to highlight in particular how they mentioned that instructors should have adequate experience with meditative practices. And we said that as well, so it shouldn't just be having a degree or having that education, but they should have the hands-on experience so they can better handle situations and their students can make the most out of the experience. In addition, there should be interviews for the people who are seeking this form of treatment or this form of intervention, and this could really help with personalizing the program.
In addition, interviewers should assess the patient's ability to contain affect, listen and respond in present, utilize instructional audio tapes and follow, listen to classroom instructions, remain in the classroom, practice yoga or an activity that is equivalent, and lastly, organize thoughts, manage logistics, and be able to commit to times. It is also important that instructors should contact participants in the case of absence and be aware of a medical problem or a serious psychological reaction. Along with being experienced guiding therapeutic meditative practices, instructors should be able to provide students with resources beyond the classroom should they experience any adverse psychological effects. This concludes our presentation about mindfulness meditation and mantra chanting. Thank you so much for listening.